Dr. DeCubellis here from Main Street Chiropractic. I wanted to go into a little bit of detail about ligaments today. I've done some other videos that kind of talk about ligaments and how they're injured, but I want to go into a little bit of depth on kind of the biology of why these ligament issues are just so important to know about, but also diagnose. So the whole thing with a ligament is it's different than a muscle. You don't have the direct blood supply or nerve supply like a muscle has. So with that, its ability to heal is going to be diminished as well. Now the problem is that when we have an injury to the ligaments, we have three things that can happen. It can be overstretched to where it's just minorly injured. That will heal at 100%. Now we also have, and that's called a sprain. Now we have a grade 2 sprain where we have partial tearing of the ligament. It's not completely torn apart, but there is tearing of the fibers. That will never heal up to 100%. Those fibers can never be 100% healed. Then we have a grade 3, which is complete tearing. That ligament is completely torn in half. The only thing that you can do is you can try to rehab the areas around it to strengthen up, to compensate, which is really not the best thing to do. And then also, depending on what ligament it is, where it is, your age, and different things, you can also have surgery to repair that ligament too. So that's what happens with those things. Now the problem is that when we have this ligament, it's made of two main components. It's made of collagen and it's made of elastin. Now elastin is what makes it stretchy. Collagen is what makes up everything else with it. The problem is that after puberty and we have injuries to these ligaments, you can't make more elastin. You make more collagen, but you can't make more elastin. So what happens then is the body is making more collagen, but some of it is immature collagen and it stays that way, and that's scar tissue. So now we have scar tissue instead of elastin. So if you have scar tissue instead of elastin in a ligament, do you think it's going to be more or less stretchy? A lot less. Now imagine you're walking down the street and your ligament should be able to stretch as you're bending your knee and you're walking, and you lose that ability. Now your knee's not going to be able to move as well. Your elbow's not going to be able to move as well. Your neck is not going to be able to move as well. You lost that elasticity, so you're going to lose range of motion or just overall motion of that segmental joint. So now your body has to start compensating. So you start moving differently. When you move differently, it puts pressure on other areas of your body and other joints, which starts, when we have that overpressure or abnormal pressure, it starts causing abnormalities. When that lasts, then we start getting arthritis, like osteoarthritis. And then because of that arthritis, you start moving even differently, and now we start getting muscle injuries. Now you start hurting in places because you're moving differently and you don't know why you're hurting. You didn't hurt yourself, and this is like a perpetual cycle. So the reason that this is important is that if we find these things early enough, we find these ligament issues early enough, we can get the best kind of results. We can get you as close to 100% as possible, but we can also make sure we get ahead of all of these postural and movement changes, all these biomechanical changes, and we can work to strengthen your body to stay the way it needs to instead of changing course and going where it wants to baby or take care of this injured area because it doesn't heal the right way because you did the wrong kind of treatment or no treatment because you didn't know it was there. So that's the goal with these ligaments. They're like the silent nemesis of your body almost, so to speak, because the other aspect of them is that there's only certain ways that they can be diagnosed, and a lot of them through movement, and most doctors don't either know how to check it or don't bother to check it. So you got to make sure you go to someone who does. So that's why it's so important after an accident, injury, trauma to get checked out, even if you're not having any major symptoms, because then at least there's no problems. Because sometimes your body is compensating and you don't feel the root or I should say the full force of what actually happened until a few weeks or sometimes up to a month later, because your body's been in compensation mode, but you're walking differently, you're sitting differently, you're moving differently, you can't work for as long periods. So the symptoms are there, they're just more in functionality than they are in straight pain. So keep that in mind. That's why it's always good to get checked out, because if nothing else too, if it comes back and everything's fine, now you have a baseline of saying at this date and time, I had no issues in my neck or my back or my elbow or whatever might have been injured. So this way it makes it easier to show in the future if you do have something that, hey, well, it happened after this point in time. So I'm Dr. DeCubellis. Hope that was very helpful.